Participate in this important hearing today. My name is Dr. Beth Mallow. I'm a practicing neurologist and sleep medicine specialist at Vanderbilt University Medical Center in Nashville, Tennessee. I'm here today in my personal capacity as a sleep clinician and researcher, and in coordination with my colleagues at the American Academy of Sleep Medicine, the National Sleep Foundation, the Society for Research on Biological Rhythms, and the Sleep Research Society, all of whom support permanent standard time as the healthy choice. I commend the subcommittee for thoughtfully considering changes to daylight saving time, which I'll refer to as DST, including consequences related to the health and the well-being of the American people. I strongly recommend both eliminating the transition back and forth to DST, as others have mentioned, and adopting permanent standard time. In my opinion, and in the opinion of other sleep medicine experts, doing so would have multiple positive health benefits. Most Americans favor those abrupt transitions between standard time and DST, and as we've heard, there is a lot of inconvenience. But there are clear adverse health effects attributed to this abrupt transition every March as well. And in a 2020 commentary published in JAMA Neurology, my coworkers and I reviewed the evidence linking the annual transition to DST to increased strokes, heart attacks, and adolescent sleep deprivation. And I've included those details in my written testimony. I'd be happy to elaborate on any of those studies in the Q&A portion of this hearing. Now, if there's general agreement that transitioning back and forth between standard time and DST is not only unpopular, but detrimental to health, then we're faced with the question, where do we land? And this morning, my goal is to talk with you about clock changes and how they affect health, address your questions about the science of sleep and circadian rhythms, and present the accumulating evidence for why permanent standard time is the healthy choice. I'll be talking a lot about sunshine today and sunlight, and permanent standard time maximizes sunlight in the winter mornings when we need abundant light to wake up and become alert, and minimizes sunlight late into the summer evenings when too much light can work against our sleep. It's called standard time because standard time lines up with our natural biological rhythms. Some Americans, including our essential workers who need to report by 7 a.m. or earlier, really stand to benefit from permanent standard time. And roughly half of our K through 12 students need to be in school before 8 a.m., with many school districts starting in the 7 to 7:30 a.m. time range. Our students and many American workers are at risk for chronic sleep loss and also what's called circadian misalignment. It basically refers to a mismatch in the timing between our work, our school, our sleep routines, and the sun, that all-important light signal from the outside world. Chronic sleep loss, circadian misalignment, or both make us more prone to a whole host of detrimental health effects throughout the lifespan, including obesity, diabetes, ADHD, depression, cardiovascular disease, cancer, and Alzheimer's disease. People with disabilities are also more susceptible to clock changes. I work on how to help children with autism sleep better, and I've cared for multiple children whose sleep worsens after this change to DST, with more meltdowns, more hyperactivity, with the changes lasting weeks, very stressful to their parents. And effective interventions for sleep problems in autism include limiting evening light, maximizing morning light. Permanent standard time would optimize both of those interventions. In summary, my colleagues and I strongly recommend eliminating the transition back and forth to DST and adopting permanent standard time, the natural and healthy choice. I'm looking forward to answering your questions. Thank you.